Good morning and welcome to our session on breast cancer in the workplace. I'm really pleased that you are joining us for our panel discussion today as we explore how breast cancer interacts with working life. We know that breast cancer is the most commonly diagnosed cancer amongst women worldwide, and there have been fantastic advances in screening, in diagnosis, in treatment that have improved outcomes. But timing really matters, and early detection is so important. And that's why we're here today, to talk about the role that you all have as leaders in HR, wellbeing, insurers and brokers in thinking about how you raise awareness across organisations, but also facilitate access to screening, diagnosis and support, and build cultures and environments that support recovery and treatment as well. So I am Jill Williams. I'm really pleased to be here today, and I'm welcoming two fantastic guests from HCA Healthcare who are great experts in this topic. My background, I'm an organisational psychologist, and the work that we do at Feel Good is all about making sure we build thriving cultures in organisations. I'm absolutely delighted to be joined by my guest, Dr. Robyn Cohen, who is a GP and who specialises in women's health and occupational health. And I am also joined by Joanna, who is a consultant oncoplastic breast surgeon, so really brings subject matter expertise to our session. I'm going to ask Robyn and Jo to introduce themselves and their backgrounds a little bit more, but as they do so, I'm keen for you just to take a moment to reflect and think about what do you know about diagnosis of breast cancer. So there should be a poll popping up on your screen right now. And I'll come to you, Robyn. We'd love to hear a little bit about your background, please.
So I'm what they call a gypsy, so a GP with a special interest. I've got a postgrad in women's health and occupational health. So as a GP, I see women of all different ages coming in with concerns regarding their breasts. And, I'll need to examine them. Every point of contact is an opportunity to educate on what a normal breast examination should be. Women need to know what's normal so that if anything changes, they can come in and see us. I also do health screening. So the corporate health screens come in. We do breast examinations. It's an opportunity to also take time to look at the women as a whole with respect to lifestyle factors that may impact on their breast health, family history, because we know there's a big link with genetics and family history with respect to breast cancer, all the lifestyle factors, and then also making an appropriate decision regarding on what is available in the corporate health screen with respect to supplemental screening, mammograms or other screens that may be needed. In an occupational health capacity, I see people after they've been to Joe and have been through their breast cancer treatment. So trying to either support them through breast cancer treatment for those who are motivated to work while they are having their treatment, or after breast cancer treatment, trying to get people back to work. So that's where I'm involved with breast cancer on all sides.
Fantastic. It's great to have you here today, Robyn, and to be able to explore both the patient side of things, but also the organisational side. Yeah. And I know that a lot of people in the audience today will be keen to think about what they can do in their organisations. And so fantastic. Thanks for joining us.
My pleasure.
And Jo, we'd love to hear a little bit about you.
So I'm a consultant breast and oncoplastic surgeon, and I see patients with any breast concern. So that may be that they've got a new symptom. It may be they've been to see someone like Robyn and had an examination and there's been a change. It may be that they've been for screening and something new has happened. And I will pick them up at any point in that journey, help to guide them through the correct assessment, plan their treatment, operate, and then work with my consultant colleagues with any other adjuvant treatment that they might need.
Fantastic. Great to have you here as well. Such deep specialism. I feel I'm in very safe hands for this conversation today and looking forward to learning lots from both of you. We will be asking lots of questions to Jo and Robyn as we go. Please do submit your questions throughout the conversation and we'll make sure we have time towards the end to cover as many of those as possible too. But let's start by considering how breast cancer actually impacts the working population and I suppose the population more broadly. Jo, is there anything you can share with us on that?
Well, 1 in 7 women in the UK will be diagnosed with breast cancer, which means that everybody knows somebody, be it a personal friend, a family member or a colleague who's been affected by breast cancer. And to put that into context, about every 10 minutes, a woman in the UK will hear that they have a diagnosis of breast cancer. I'm conscious that our entire audience won't only be women. So breast cancer does affect men. It's about 1% of the breast cancer diagnoses in a year. So to put it into context, I operate on about 1 man a year with breast cancer. And what we know is that we're seeing earlier diagnoses. And because of that, these diagnoses will impact on people within their working time, which will impact both their career, but will also impact their colleagues around them. So it is important that we consider all of this.
Absolutely. It's not, as some assumptions might be, a sort of a post-retirement challenge. It's actually about how do we make sure people are getting the right treatment, the right support, and the environment around them is aware of the impact of that on them. And we'll definitely explore that today. That's really interesting to hear. And that statistic about, every 10 minutes, really brings it home. Robyn, you must see a lot of this in terms of your GP practice then.
Yeah. So, often, I don't know what the answers are for the poll, but often breast cancer will be diagnosed when women are at the peak of their careers. They've worked hard, they've achieved positions of seniority or specialist areas, and then they have families at home, they have colleagues and teams working under them, and then they get this diagnosis. And it not only impacts obviously their physical health, but the family and the whole team at work. So we need to get them the best care that they can. And we'll talk about the importance of picking this up early, but so that we can get people back to their normal lives, as a mother, as a daughter caring for elderly parents, and as a team leader or team member performing, the full aspect of their role. So, when we pick things up early, the treatment is less complicated, the side effects are less, and we get people back to work quicker without, the side effects of some of the chemotherapy and radiotherapy if we pick it up later. So everyone is different in how they react. I've got patients who, will work through their chemotherapy, they're determined, and some people who just the side effects are too much and they have to take some, significant amount of time off work.
Absolutely. So it's so important for organisations to understand the differences around that, and we can explore that as we can. Absolutely. And you've mentioned the poll there. I think what we can see is 71% of people joining us today think that the average age of diagnosis is between 40 to 49. But I understand from both of you it's maybe a little bit later than that.
I mean, we do see it in that age group, and it's definitely going up. But I think that you would expect to see it in a slightly older population. So sort of mid-50s is where you'd see the peak, but you're certainly building up. So by the time someone gets to the age of 40, it's just over 1 in 200 or 20-ish people will get it. By the time you get to 50, it's about 1 in 50. And then it starts to creep up. So the biggest risk factors are being female and aging.
Interesting, yeah.
But what's interesting about the poll is that if people thought it was between 40 and 49, the National Health Screening Program only starts at age 50. In our corporate screens and in private, we offer it to women from age 40 because we know that it's rising in this age demographic, and often it's more aggressive cancers that will be picked up in this younger demographic. But that's really interesting that people thought it was from 40. Unfortunately, there is a big demographic of younger women that are getting breast cancer. So from a corporate perspective, the fact that we are offering, breast screening, mammograms from age 40 is important. But as Jo said, it's usually the biggest group is slightly older.
Absolutely. And if we think, we're working later into our lives and everything you've mentioned, Robyn, in terms of the peak of people's careers, the responsibilities that women tend to carry outside of work as well, and that all colliding together. Absolutely. It's important to think about how can women best be supported and what is the workplace's role within that. You touched upon early detection there and the role that organisations can play in that. Can you share a little bit more, Robyn, about the impact of that and what that looks like?
Well, if we pick up a cancer early, so stage 1 cancer, if you look at the 5-year survival rate, it's almost 100%. And the treatment, Jo can tell you a little bit more about it, but a stage 1 can often, if it's caught very, very early, we can get away with just surgery in some cases. Whereas if it's a stage 4, the survival rate can be around 25%, and the treatment is so much more intensive, from a lumpectomy versus a full mastectomy with lymphatic removal, chemotherapy, radiotherapy, and then hormonal treatments afterwards. So the side effects and the duration of the care or the treatment plan is so much longer for a late cancer versus an early cancer. So picking it up early is key. And that's when a GP capacity and health screening capacity, it's all about education, having open conversations, reminding people on how to do a breast examination, what to feel for, what's normal, so that you can come in and have a check, and getting appropriate adjuvant screening if we find something.
Absolutely. And I think, what you're talking about there just shows that there's such a material difference between early detection and not, and the role that screening can have in that, particularly given what we're talking about it, perhaps people not being screened until later in life. I think this is a great opportunity to turn to our first case study, and we're going to hear about this through the lens of a patient. So I'm really keen to introduce you to Andrea, who has really generously and kindly offered to share her story right now.
I'm Andrea, and I booked with HCA. This was for my annual screening with my company. They encourage us to have an annual health screen each year. And so I booked that, and off I went along to the screening. So it was really a routine screen as far as I was aware.
How did you feel about your health at the time of doing your health screen?
I felt healthy. And the funny thing about it is, about a week before I was at the gym, and I was really happy at the gym. And I was like, oh, this is great. I'm doing well at my age, going to the gym, everything's great. So I was feeling quite happy, quite healthy. And so I didn't really have any major concerns. And, I was quite comfortable going to this. Just thought it'd be another routine. Yes, come back next year. You go along and you have all the usual tests, the blood tests, they weigh you, height, blood pressure. So we went through everything. And then towards the end, then she did the breast check. And she was then a little bit worried about something. She felt something that she didn't think was right. And she said, you know what, I think I'd like to, I think I'm going to have to refer you. The mammogram for me showed no signs of anything. But by having the ultrasound, that can give a better picture. And they were then able to, they saw that there was a small lump, could have been a cyst, could have been anything which wasn't showing on the mammogram, but the ultrasound did pick that up. At one appointment, they were able to do the mammogram, chest x-ray, physical examination, and the ultrasound, then the biopsy as well.
So the importance of the early screening was really significant in this case, and having that mammogram and that one-stop breast clinic early.
Yes, it was, absolutely.
Can you describe kind of your treatment plan following that meeting and what that involved?
So I was lucky because it was small. They're able to do the breast preserving method rather than having to do a full mastectomy. So I had lumpectomy. And then once you recover from that, I had to have 15 lots of radiotherapy, targeted radiotherapy. So you have to go up to the hospital every weekday for 3 weeks and get this radiotherapy. The radiotherapy is not dreadful. I personally didn't have any real side effects apart from skin redness, but from my point of view, radiotherapy was not too difficult. And after that, the treatment plan for me was to have hormone tablets after that for 5 years.
And what would you say to other women about the importance of attending your regular health screening and mammograms? I
certainly would advise that make it a regular annual thing that you do. Definitely paid off for me in that I would have had, it could have been a much more tricky outcome for me if I hadn't have had it checked over early.
Thank you to Andrea for sharing her story so openly with us. I think it really, for me, really added that lens in terms of why that early detection is important. And I know, Robyn, we've been discussing in the past why that matters and why for so many people they want to avoid chemotherapy.
Well, I think firstly, it's such a big shock when someone says to you they've found something, and everyone's reaction to what the word cancer or breast cancer, it means so many different things to different people. And we have to realize that everyone's fear is unique. And some people, they fear about surviving. Some people, it's going through the surgery. And a lot of women, it's about also the physical changes that may occur from needing a mastectomy, so the whole body image changing, to if you have to go through chemotherapy, losing your hair. It's part of your, as Joe was saying earlier, it's part of your armor. So if we pick it up early, we can simplify the treatment, and all those fears we can try and we have to manage them as we go along on an individual basis. But if we pick up early, so in Andrew's case, she didn't need to go through chemotherapy and she didn't lose her hair, which is for a lot of women, the most scary part of it all.
Yeah, absolutely. Yeah. So it's the positive outcomes in terms of their physical health, but also that has a huge impact on mental health and how they are feeling confident in the workplace, as well as that armour can provide so much confidence to women. I experience that, and I know a lot of my friends, colleagues and clients do as well. Absolutely.
I know when I see ladies in an occupational health capacity are often coming back to work after they've completed the cancer treatment is very scary. And the thought of, what are people going to think about? Now, I used to have long straight hair. Now my hair's starting to grow back and it's short and curly. Or are they going to look, have I had a reconstruction? What are people going to think about my physical appearance? That's one of the challenges as well about going back to work.
Absolutely. It's a shift in identity, and it's much more acute for women than for men in that sense. Given that's a whole other conversation, I think, about women's appearance, but we'll not go there today. Absolutely. Joe, would you be able to add to this conversation a little bit more about screening and what that looks like, because there's been so many great advancements that HCA have made?
So we have put a great emphasis on making screening more nuanced. So it used to be that we had a one-size-fits-all type approach, and we now know that we need to think about this a little bit more. And some of that will be related to family history, and we know that only a very small percentage of breast cancers are related to a genetic predisposition, around 5%. But there are lots of other factors. And the one that has really come to the forefront recently has been breast density. So we are aware that different breast density will affect risk for breast cancer. So it's an independent risk factor. And we are now talking about this. Women will be aware of it. And in fact, in HCA, we're actually publishing what the breast density is on a mammogram. And we're using that to help us give women choices as to what would be the best way to image them. And we grade people into A, B, C, and D. So we're looking at really the proportion of the fatty tissue and the proportion of the breast tissue. The greater the amount of breast tissue and the closer it is packed together, the more difficult it is for us to read the mammograms, and we may miss things if we're just going to use the conventional mammogram that we had before. So A is a very fatty breast, and D is the greatest breast density that we have. And we expect that to be around 10% of the population. If we're screening women when they're younger, we may see greater breast density, and also hormone exposure will have an effect on it. But we know that we need to think about now how that breast density is going to impact on risk, and how we can mitigate that by being a little bit more nuanced in the way that we screen.
That's fantastic to hear, and so reassuring to hear about the nuance, the bespoke, the more individualised pathways and the choices that are available. It's amazing how far technology has come in that sense, absolutely. And what about advancements in terms of treatment and what treatment timelines look like? We have a lot of people joining today who are probably thinking about, how do our organisations support people who are going through treatment? What does that look like?
So it is tricky, because breast cancer is 2 words and it's hundreds of different types of cancer.
Absolutely.
And as well as screening being more nuanced, we are looking about bespoke patient-centred care. So every individual should have a treatment plan which is really formulated for them and their particular breast cancer. And that will depend on lots of different factors. But the timing at presentation and the disease burden will affect things significantly. So what we're hoping for is that we're going to have early detection, and then we're going to be able to de-escalate treatment. And that will be in every stage. So we're hoping that we're going to do smaller surgeries in the breast. We're going to do less interference with the lymph nodes in the armpit. We may need to give no radiotherapy or less radiotherapy for fewer days over a smaller area, and then what the drug treatments are going to look like. So I think what we really want is to educate women to understand about what their breast looks like normally, to find an early change if there is one, and to feel empowered to be able to see their clinicians and say, I think something's wrong, and then come to a symptomatic clinic. But also we want women to be coming for their screening, and we want that to be regular. We want it to start earlier, so we're offering it from the age of 40. And we want it to be bespoke to each individual.
Absolutely. So that importance of organisations, but also as a society, in terms of raising that awareness, empowering women with the information they need to take an active leadership in their own health is so important in terms of that.
And our demographic of women are a global population. We have women working in London from all over the world, and these are educated women who know about supplementary screening, who do know about dense breasts, and different parts of the world, having these supplementary screens, whether it be MRI, contrast enhanced mammogram, or an ultrasound with their mammogram, is expected. So, we do have a duty of care to educate our patients on the latest research, and at HCA we do have all these advanced, screening options. And like Joe said, to find something that's a balance that corporates can offer, but also if we need to, we have to individualize and give what we believe is, or recommend what we believe is the best screening modality to pick up, in each individual. And a case I thought of is someone even younger, a woman who came from Canada. She in her early 20s, she had radiation exposure for the treatment of a thymoma. And she recalls in the back of her head, her oncologist saying, you need to have breast screening because you've had radiation exposure. If you have a lump, you must, be seen, but you need to have screening because you've had a significant amount of radiation exposure. And she went to grad school, law school. She came here, got on a grad scheme, and life got busy. And she presented to me at age 27 with a lump. And luckily, I was able to get her to one of Joe's colleagues quickly. But, that kind of individual should have a more advanced screening program with more regular MRIs because she's at higher risk. So we have to always individualize. We can't say, oh, you're 27, you don't need any screening. There will be people who have strong family histories, who have had the genetic screening, and will need to have more regular screening. And it's about finding the best, safest screening procedure and plan for them.
Absolutely.
I think that it's really important that we educate women to understand that not all mammograms are the same. So there are lots of different ways that we can do a mammogram. And although the machine looks the same, and I think any of us who've experienced a mammogram understand it's not the most dignified of experiences.
Certainly not.
In fact, we can set the machine to give us much clearer pictures. So one of the things that we can do is what the Americans would call a 3D mammogram, and we call tomosynthesis. So that enables us to tackle some of these issues with breast density in a really kind of neat, quick assessment. And then we can supplement that with ultrasound. So, and that will enable us to pick up more changes, early changes, small changes. It also helps us to differentiate between something on a standard mammogram may look concerning, we can easily say actually isn't. So whilst the emphasis on this is about breast cancer, if 20 women come to my clinic with a concern, 19 will go home with good news. So this is a good news story, but we do need to make sure that we're getting the assessment correct. So we are reassuring women correctly early, and then we can concentrate on women who do have a significant change and significant pathology.
And that reassurance is so important for reducing anxiety levels, decreasing the stress, but also for the one woman who might need to go further, then actually that de-escalation of treatment that you've talked about will have such a positive impact on her as well. And I'm keen at this point that we welcome in another voice as well and hear from Nehar around treatment and what that looks like in terms of the support that's needed.
My name is Neha. I'm a clinical nurse specialist at HCA Healthcare UK at London Bridge Hospital. My role is to support patients throughout their treatment and experience of their breast cancer diagnosis and moving beyond what happens after they've received that information. So we, the clinical nurse specialists as a team, we actually support the patients all the way through, whether it's emotional support, psychological support, or physically anything that they need during their treatment. We are there to get them through this. That's, in summary, this is what we do. I think fatigue is one of the most important sort of side effects, especially if you have systemic treatment like chemotherapy. Fatigue generally accumulates over months and years, and when you have those kind of treatment, it does affect you. Sometimes you get something called brain fog, so you might not remember things. So those sort of patients need extra support and guidance, and how they can sort of go through with this and help themselves recover. Often after patients' treatment is finished, we encourage them to, or even during their treatment, to be honest, like we encourage them to exercise and continue being active, because that usually helps with fatigue in the long run. The other side effects in terms of what they go through during their chemotherapy, for example, those ones, there are medication that can be given to help those side effects. But generally speaking, fatigue and psychological help, that's probably what they need the most. And we do have a team of psychologists within HCA. There's a hub of psychologists that we refer patients onto, and they see them and give them those support. So my takeaway message from this is, I always tell my patients, if you don't remember anything, remember that early detection saves lives. And you'll hear that everywhere. And I'm not just saying it because it's a slogan for everybody, but actually it really does. Early detection saves lives. And as I explained earlier, the sooner you detect this cancer or this problem, we can deal with it and we can get you through. The sooner the treatment can start.
Thank you, Neha, for sharing more about what treatment can look like and the impact of that on people. Robyn, we'd love to hear a little bit more about this, what people might face through the treatment, but also thinking about when they're returning to work specifically, what the impact might be for them and what's the role of the workplace. And as you answer, I'm going to open another poll, which will get everyone thinking about how set up they feel their organisations are to support this.
So I think survivorship is complex. So, people pop open the champagne when Joe gives them the all clear, and then there's almost like this pressure and expectation. Now I need to go back to everything I did before, be the super mom, the super daughter, be the career blazing overachiever that I was before. But there can be physical and psychological consequences from going through, the treatment. So often, women will keep it together while they're going through treatment, and then sometimes when they've been given the all clear, there can be psychological ramifications. So it's really amazing. We work with a multidisciplinary team, and I can refer, to psychologists to support with that. Neha spoke about the fatigue. Different women react differently. Some people, their energy comes back quicker, but sometimes there is this accumulation of fatigue and lower energy, and we have to be mindful of supporting people to build up their endurance again, taking on the normal responsibilities of their life. There can be physical symptoms, peripheral neuropathies, tingling of the feet, numbness of the fingers. There can be lymphedema if lymphatics have been removed. There can be joint aches and pains. There can be menopausal symptoms because some of the hormonal treatments will put women into a menopausal state. So it's about looking at each individual and assessing their needs, and then liaising with the companies to see what practical adjustments can be accommodated. Usually I suggest a phased return with regular check-ins to see how people are coping, and we tweak it as we go along. So some people go, oh, this is too easy, I'm fine, and then we can escalate. But sometimes it takes longer to get people back to their full responsibilities. And then there's also, every couple of months there may be review scans, the anxiety and the lead up to that. So it's supporting individuals with understanding that they may need time out of work for these appointments, and the psychological impact of what it means to come back a survivor.
Absolutely. So just because the champagne has been popped doesn't mean the journey is over at that point, that there's still so much that's needed. And I think it's great to hear with your occupational health hat on there, the role of adjustments and phased return and
managers
support.
just being understanding that even though they are cured or their treatment is finished, that there may be some longer term sequelae.
Yeah, absolutely. That compassion, the understanding, and the importance of making sure there isn't stigma in the culture in terms of asking and voicing for what you need in terms of support and making that
and
okay
being
within
understanding.
a team.
Sometimes there's a bit of brain fog. It can take a while. I know even after a holiday, sometimes it takes me a while to get back into the headspace of work. So a bit of cognitive slowing, a little bit of, things may take a little bit longer to complete, but just being understanding that may occur.
Absolutely. And I think it's both the physical and the psychological that you've spoken to throughout the whole discussion so far. And I know so many of the organisations joining us have such great access to counselling support, to mental health support, as well as things that will support the physical health, and making sure people are aware of that the awareness is raised, things are signposted to them.
I think it is really important that people understand that once the surgery's done or the chemotherapy is completed or the radiotherapy, we are still expecting to be following patients up in this period of surveillance for 5 to 10 years. And if you're diagnosed when you're younger, then you're looking at least 10 years of follow-up. And during that time, we're also very often still treating patients with medication. And whilst that medication is a simple tablet that you take, actually the side effects from that can be very far-reaching. And patients will need to come for regular follow-up. So there's new tablets that are coming through, there's new classes of drugs. Some of those require blood test monitoring and issuing of drugs on a 2 to 3 monthly rolling basis with a check-in with your team. And apart from that, there's regular imaging. So we're expecting to image people annually for 5 to 10 years. And the build up to that can be very difficult for people because it brings home a lot of memories.
Absolutely.
And there's the uncertainty of what that might bring. So whilst, yes, it's a big champagne moment, there is the realisation that actually we're moving into just a different phase. And I think that has to be something that's appreciated by the people around you and your colleagues.
Absolutely. And I think what you're talking about there, Jo, in terms of the anticipation of what that may or may not bring, the memory, the experience that they've gone through, any trauma related to that, and just the anxiety that might come with that, having the awareness of that, as well as the physical side effects of ongoing medication. So important for managers and organisations to think about what do we have in place to support that. And I'm just looking at our poll here. And I think, we've got about a quarter of the audience saying, yes, we're confident we have what's needed as an organisation to support people with these examples. But half of the audience saying, somewhat. And then the other quarter saying, no, not really, or not at all in that sense. So sort of still a bit of room to go. And some of that might be in terms of the occupational health approach, but it might be about actually education and awareness of the examples that you're both giving me today that is definitely helping me learn more about what those phases of treatment look like. I think one thing I'm really taking from this conversation is about early detection and the importance of that. But Jo, I'm wondering, could you say a little bit more about, why prevention really is better than a cure, and what the organisation's role is in terms of helping enable that?
So we really want to encourage women to understand how important it is to know the roadmap of themselves, because whilst we do offer screening and we encourage it, we know that women will pick up issues themselves. So we want them to be able to voice that concern, and then to be able to have a quick route into being able to see a clinician. Because if we can pick something up early, we will be able to de-escalate what we're going to manage in terms of significant pathology. But we may also be able to very rapidly reassure someone that there isn't an issue, and that this is a change, but it's an entirely benign, harmless change. Because actually having that worry on your mind really can make it very difficult to focus and concentrate on other things. Absolutely. Uncertainty is the most difficult thing to manage for people. And the kind of reassurance that we can give is very quick. So we're expecting patients to come in and have, if they have a symptom, a one-stop service. So they're going to meet a clinician like myself. They're going to go in through for thoughtful, bespoke assessment, mammogram, ultrasound, and anything else. And they will get those imaging results on the same day in the appointment, so they will know whether we think we're dealing with something.
And even a biopsy on the same day.
Yeah, if it's harmful, and if we need to do a biopsy, we will most of the time be able to do that on the same day. and our turnaround time for pathology is really very impressive. So we would expect within a week to have an answer.
That
And
is
sometimes
phenomenally
it's
impressive.
quicker. I've had patients who 2 or 3 days, and that waiting period of the anxiety, I think, is the worst for patients.
Yeah, absolutely. That's phenomenally impressive. And I think, as you say, the waiting period, the uncertainty is so hard for people. It can become all consuming in your mind. I know I've definitely been there. So it's great that can be turned around, and organisations can help people access that, make sure that they've got the right offer and the private medical cover for employees to gain that support and to reduce that psychological pressure on them. Absolutely. I'm keen that we turn to some of the questions that have come in from our audience. So if you've got a burning question for Jo or Robyn, please do submit it now. This is your chance. And we're very open to all questions coming in, and we'll try and get through as many as we can. So the first question that we've received is more about support, and it's about what support is available or that you would advise to prepare patients pre-surgery and post-surgery, thinking both about the physical and mental side that we've touched upon. Jo, I'll come to you.
So when we are preparing patients for surgery, they obviously get time with a clinician like myself to run through what the surgery is going to be, but they also get separate time with our clinical nurse specialists. So we're very lucky to have a team of clinical nurse specialists at HCA, and there will be a clinical nurse specialist attached to each breast unit, and they will take time to prepare a patient. So what they need to think about in advance, and then also give them very sensible advice about when they will be able to go back to some of the things that they could do beforehand. It is important to overcome any surgery. You do need to have some rest. So we will be quite prescriptive initially about how much time people need to have off. But we are also mindful of the fact that working is very important for some women, and they don't want to feel that their diagnosis has overtaken everything. So we are very keen to support patients to get back into the workplace at appropriate points during their management. And some of that can now, fortunately, be done often remotely, which works really well for patients because they are able to contribute to the workspace, do lots of the things that they did before, but they don't need to battle through the transport issues and so on to be able to do that. So we are giving lots of advice all the way through. And we also have a team of psychologists, as Robyn has said, who are able to help patients prepare for some of the changes that they may have after their surgery.
And it's also small practical things, like after you've had breast surgery, you can't lift your arms to wash your hair. So like planning for a hairdresser visit or someone to come and help you wash your hair or help you with dressing it, depending on the extent of your surgery. So I think the nurse specialists are really good at those little practical things that, pre and post surgery that you need to think about.
And for people who are facing larger operations, we are able to give someone a buddy, so someone who's been through a similar operation and experience, so that they can speak to them about some of the things that we as clinicians may not put so much emphasis on, but actually are really important to be able to get yourself back into your normal routine.
Absolutely. And having people like the nurse specialist and the buddy that are sort of beyond your family and friends to really talk about the things that you're most worried about is so important.
Small tips: where to get the best wig, where to have your hair treatment. Some people want to put these cold caps to preserve their hair, if they're going to have chemo, all these little tips. What if you are going to lose your hair, if your scalp will burn, what to put on your scalp, all these practical little tips that you may not think of but will make your life easier.
And it's the practical tips that will make your life easier, but also feeling like you're not alone with it then as well, and the impact of that. And I think, Jo, it's so interesting what you were saying as well about that balance with rest and with work giving people a sense of purpose. But I know for an awful lot of my coaching clients, which are, very accomplished women, that rest doesn't come easily. They are juggling so much. They get so much of their sense of fulfillment from throwing themselves into work. And that might be something to relearn, and thinking about how can they still contribute at their highest value, but how can the organisation and their managers support them in saying, okay, that's going to look different. And thank goodness for hybrid working and all that's given us in terms of flexibility around that. We have another question that's come in that is definitely an area of interest for a couple of people, and this is about supporting. So we've got one question that is around what can organisations do to support colleagues and managers, equipping them with knowing what to say and probably what not to say and what to do and what not to do. And then another question about, the men in these women's lives are, I'm going to extend that to other people who care about them as well. So I'd love to get advice from both of you about colleagues, but also sort of personal relationships.
Well, we go into organisations, and I've gone in with our psychologist colleagues, giving presentations on a whole array of topics, but in particular cancer and breast cancer, on tips for this kind of thing. So, having education campaigns and being given the advice on how to, it's very hard for someone going back to work with the best intentions. People may put their foot in it and ask the wrong question. So, preparing women, for going back. Some people, are happy to share their whole journey, and others are very private. So on the one side, it's preparing the patient on how to go back to work and put their brave face on and become setting their limits. And then also preparing the workforce when someone is coming back, a kind approach and what may be appropriate and not appropriate. So we do have teams who can come into your organization and give talks on this kind of thing.
Oh, that's fantastic to hear. Absolutely. And I think, one thing we often get asked as well is around, well, what if we don't have huge resources as an organisation? Budgets are tight, or we're a smaller organisation. What does that look like? Have you got any advice about what to prioritise?
Well, firstly, there's so much resource out there, for Breast Cancer UK, we've got this white paper that's coming out to you afterwards that's got a lot of information on. And I think just being human and kind is the most, and understanding, like you said, it's the individual, but it could be the husband that's being affected who's dealing with caregiver responsibility. So to be mindful that it may not be the patient who's returning to work, but there's a spouse who's supporting an individual. It may be a colleague who is dealing with the workload of someone who's been off for 6 to 9 months. So, just seeing everyone who's impacted by it and just being mindful that there may be an additional burden placed on them, and being human and kind is what I would say.
And you asked a little bit about partners, and so I think it's really difficult because with a person that is the main supporter for an individual who's got breast cancer, the breast cancer patient is holding a bit back from their main supporters, and their main supporters are also holding a bit back from them. So the things that are worrying them the most, they may not be able to say to the person that they're supporting. So I think it is really important that their colleagues, their managers, their occupational health colleagues are all there to actually acknowledge that it's not easy to be the partner of someone who is going through breast cancer and watching them go through a lot of treatment. And some of the fears that you have, you will hold in yourself. So I think it is important that we acknowledge that and we make ourselves available for people. And sometimes it's just to listen. You just need someone to listen and to be a little bit understanding that actually, whilst it wasn't usually your role to be doing these things in the background at home, at the moment you need to, because you are the one that's taking the pressure off. So it is about providing that flexibility.
Absolutely. I think that's such an important point, that as the partner, not only are you taking on a huge amount more at home, you're providing that support for everything they need, but likely you're providing that psychological support. And that includes perhaps not sharing what your greatest fears are. Where's their outlet? Who can they turn to?
Yeah.
And I think the importance of this sort of the kind human approach and the listening should never be underestimated at all. And there's a lot that organisations can do to facilitate that for so many health issues in the workplace. Absolutely. I think we could keep talking for several more hours, but I'm very conscious of our time. Robyn, you mentioned a white paper that will be made available to everybody after the session, along with HCA's employer toolkit that provides more detail on everything you can do to support. But what I would love to do, just to wrap everything up, because we've covered a lot of distance here in terms of really understanding the importance of that early detection, thinking about, the advancements in how that is done now, but also individualised pathways for treatment, what the physical, the psychological effects are in the organisation's role. If you were both to leave our audience today with one piece of advice about something they should think about going and doing after this conversation, what would you like to leave them with?
Well, we are encouraging people to support this idea of screening. So I think it is, and it's difficult to sort of decide how you're going to tackle that. But I think it's first of all making women aware that it is available for them, and that it's available from the age of 40, and that we would manage that probably about every year for the first between the age of 40 and 50, and then extend the time different between the screens. And that people shouldn't be worried about attending for this, because if something is found, then not only will they get early detection and better treatment, but that the organisation that they've come from is going to support them.
Love that.
No, I'll echo that. Never miss a screening opportunity, and just do regular breast checks so that if there's any change, skin change, nipple change, a new lump, go and see your doctor.
Fantastic. A really clear message there from both of you. Thank you so much for your time and your generosity with sharing your expertise. I've learned a lot. I've been inspired as a woman in my 40s to go and get screened. So thank you for that. And thank you all so much for joining us. Look out for that employer toolkit. Also look out for the white paper, which provides some really interesting research and perspectives. And do connect with HCA Healthcare and Feel Good on LinkedIn. And we're always open to receiving more questions. Thank you so much for your time. Thank you both. And I hope to see you at a future panel.